What's the matter with it? And he said my name?
And then I have to do it after. The name of my speech is Type 2 Diabetes. According to the Mayo Clinic, type 2 diabetes, once known as non-insulin dependent diabetes, is a chronic condition that affects the way your body metabolizes sugar, the body's main source of fuel. My mother's family circle has issues dealing with type 2 diabetes. Living with diabetes has its limits for my mom's family. Every day they have to battle the illness of type 2 diabetes. My mom's family have to take insulin every day in order to keep their blood glucose under control. It is a constant struggle to deal with type 2 diabetes.
That's it.
What are the causes of type 2 diabetes? According to the Mayo Clinic 2012, a person that body is non-insulin dependent or resistant to insulin has the cause of type 2 diabetes. The Mayo Clinic also states that excessive weight gain is a contributing factor to type 2 diabetes. Another cause of type 2 diabetes is lack of exercise and inactivity. Now let's move to the signs and symptoms. What are the signs and symptoms of type 2 diabetes? According to the New York Times, the signs and symptoms of type 2 diabetes is excessive thirst, frequent urination, and weight loss. The New York Times also states that fungal infections and yeast infections on the breast and groin area of women is a sign and symptom of type 2 diabetes. Another sign and symptom of type 2 diabetes is unusual tingling sensations in the extremities of the body. Now let's move on to the treatment plans for type 2 diabetes. What are the treatment plans for type 2 diabetes? According to Franzo 2012, the treatments for type 2 diabetes can be oral medications of metformin. According to the Mayo Clinic, regular exercise and a healthy diet can lower blood glucose levels in diabetic patients. The Mayo Clinic also states that a regular insulin therapy can be used to lower blood glucose levels in people. Now let's move on to the conclusion. Living with type 2 diabetes can be difficult for my mom's family, but with diet and exercise and a great insulin regimen, they can defeat the disease. They just have to be willing to overcome the obstacles of type 2 diabetes. And that's the end.